Aloha everyone, I'm your Van Dyken MD from Out of the Doldrums. I'm a surgeon by trade, but my true passion is helping people just like you obtain optimum health. I'm here today to provide another update on the SARS-CoV-2 virus and its associated illness, COVID-19. My goal is to help keep everybody updated with the newest information possible. Keep in mind, this is a rapidly evolving situation, and we're finding out more and more about the virus and the illness every day. What we know about the virus and the illness literally changes on a day-to-day basis. As the COVID-19 pandemic grows worldwide, new studies are working on answering questions on how the virus is shed, which gives us more information on routes of viral transmission. We all know that the main route of transmission is respiratory droplets, but could there be another route of transmission? In this video, we'll be reviewing brand new research done on SARS-CoV-2 and gastrointestinal or GI manifestations. Current studies revealed that the majority of COVID-19 symptoms are respiratory, things like fever, dry cough, shortness of breath. The way we test for COVID-19 is by swabbing the nasal or oral passage with a Q-tip type device called a swab. In other words, we get a respiratory swab. In addition to respiratory symptoms, though, we're also seeing GI symptoms like diarrhea, nausea, vomiting, and abdominal discomfort in some patients. Interestingly, these GI symptoms seem to appear early in the course of the disease, even before respiratory symptoms appear. Scientists describing the Wuhan experience state that about 10% of patients presented with diarrhea and nausea about 1 to 2 days before the development of fever and respiratory symptoms. A research paper outlining the clinical course of the first 12 COVID-19 patients in the United States showed that 10 of the 12 experienced GI symptoms. They then detailed the very first case in the United States, which began with a 2-day history of nausea and vomiting and then hospitalization. The patient also supposedly had a loose bowel movement after admission. So about 2 days after this is when the respiratory symptoms appeared. They tested the patient's respiratory secretions and stool, and they found that there were viral RNA particles in both. In a separate paper, it's described that 2 independent laboratories from China declared they've successfully isolated live SARS-CoV-2 virus from the stool of COVID-19 patients. Why do we even care about this? Well, taken together, there's a growing number of clinical evidence that suggests that the digestive tract may serve as an alternative route of infection. That means the virus may also spread by something called the fecal-oral route. What is that, you might ask? Well, fecal-oral transmission is defined as a particular route of transmission of a disease where pathogens and fecal particles pass from one person to the mouth of another person. I know it sounds a bit gross, but it's actually quite common in the spread of many diseases, especially GI bugs. A classic example of fecal-oral spread is cholera. Most of the time, this spread happens because there's not adequate sanitation, meaning no adequate sewers, or there's poor hygiene practices like lack of hand washing after using the bathroom. This happens all over the world, even in developed countries. UNICEF actually made this diagram called the F diagram, describing fecal-oral transmission. The F stands for feces, fingers, flies, fields, fluids, and food. So, in order for fecal-oral transmission to occur, we have to prove that the SARS-CoV-2 virus actually infects the GI tract and comes out in the stool in live form. Let's back up though and start with asking, how does the SARS-CoV-2 virus infect the GI tract and the respiratory tract? In order to explain that, we've got to get a bit sciencey. Bear with me, it won't be long. We'll be back to the basics soon. We know that SARS-CoV-2 is a coronavirus, so it has all these little spike proteins around it. The spike proteins bind to specific receptors in our body tissues called ACE2 receptors. Once the virus binds to the receptor, it gets into the cell and infects it. Well, it turns out we have both ACE2 receptors in our respiratory tract and in our GI tract. This means the virus is binding to the receptor and invading cells in both places, and it explains the viral shedding that we see in stool tests. Finding the virus in a stool test raises the question of a fecal-oral transmission route. Let's quickly review a recent paper. It's titled, Evidence for Gastrointestinal Infection of SARS-CoV-2, submitted to the journal Gastroenterology for publication. This paper comes from researchers in China, where they examined the viral RNA in the feces of patients who had SARS-CoV-2. They also obtained actual tissue from one patient volunteer, esophageal, gastric, duodenal, and rectal tissue. These were collected by endoscopy, if you were wondering. What they found was that among those 73 infected hospitalized patients, 39 of them tested positive for SARS-CoV-2 RNA in their stool. That's 53%. Furthermore, they found that 17 patients remained positive in their stool test after showing negative tests from their respiratory tract. This led them to suggest that the virus may live in the GI tract for longer than it lives in the respiratory tract. Back to that one patient they convinced to let them get samples of esophageal, gastric, duodenal, and rectal tissue. They stained this tissue using something called immunofluorescence, and they found that there were high levels of the ACE2 receptor, and they also found positive staining for SARS-CoV-2 inside the cells of the stomach, duodenum, and rectum. After the virus enters the cells, virus-specific RNA and proteins are synthesized and assembled into new viruses, which are then released into the GI tract. The continuous positive detection of the viral RNA in feces suggests that viruses are secreted from the virus-infected GI cells. The same scientists isolated infectious SARS-CoV-2 in stool, raising the level of evidence that fecal-oral transmission occurs. So at the end of the day, what does this mean for us? We're still learning so much about the novel coronavirus, and one of the things we're learning is that there's a likelihood that one way COVID-19 can spread, in addition to the main mechanism of respiratory droplet spread, is via the fecal-oral route. This is critically important. If we're aware that this is a potential way of spread, we can hopefully slow it down from that standpoint. So what can we do to slow down the spread? Here's a few key strategies that we can implement today. First, work on washing our hands after going to the bathroom and before eating or touching your face. Second, make sure our bathrooms and toilets are regularly and appropriately disinfected. Third, keep the toilet lid down at all times to minimize potential spread. Fourth, if possible, try to avoid public restrooms which may contain viral particles from others. One more reason for social distancing and staying at home. Lastly, if you're a healthcare institution, there's a paper in the journal Lancet which gives the following advice. Strict precautions must be observed when handling the stools of patients infected with coronavirus, and sewage from hospitals should also be properly disinfected. This could potentially be a huge issue. How is your hospital disinfecting their sewage? Are they? So there you have it. I hope you learned some information about COVID-19, and I hope you can institute some new measures to minimize how this virus and illness spread. Please let me know in the comments below what you think of this video. If you like the video, please give it a thumbs up. If you want to show us some real support, subscribe. We love hearing from you, so please comment below with other topics you would like to hear more about in the future. Until then, everybody, stay healthy, stay well, and aloha.